My name is Jacqueline Servin, and today I'm going to do my last persuasive speech for this course. So let's start. Think of the good old days when we could walk by each other not having to wear any face masks. Ask yourselves how great it would be to live in a world where we can socialize, hug each other, be around each other. But even during these hard times, we have somehow made it harder to wear masks in public. We may have busier lives with hectic schedules, which can make it extremely difficult to grab a mask and put it on our way out. However, that is the contrary to what we have learned. These past months, we have learned that the less we wear masks and not follow COVID rules, the more the spread of the virus continues, which it makes it difficult to have a normal life. This is my purpose. Today I'm going to persuade you to take action to help to stop and prevent any more cases, and how through us refusing to wear masks has a direct effect on our economy as well as our health. I will be going through what COVID is and how not wearing a mask has taken a toll on our pandemic and how we can help to put an end to COVID. First off, let's talk about my main point, which is COVID. COVID-19, also known as coronavirus, is defined by wikipedia.org as an infectious disease caused by severe acute respiratory syndrome coronavirus 2 SARS-CoV-2. It was first identified in December 2019 in Wuhan, Hubei, China, and has resulted in an ongoing pandemic. It is a virus that has a hold on your overall health and has the greatest impact on people with weak immune systems. However, it can attack anyone from infancy to adulthood, even pets. Some statistics, for example, according to the Center for Disease Control and Prevention, which you can go into www.cdc.gov, on October 9, 2020, they said that there are 7,583,200 COVID open cases and 212,111 COVID deaths. These are just numbers in the USA. Although it seems that we have been able to manage COVID, however, we are nowhere near having a vaccine to cure or to help to prevent any further cases. Although they're trying to make many research to gather and they're trying multiple things, it's still not nowhere near for us to say that we are in the safe zone. So now that we have established what COVID is, let's look at the problem. Well, some of the causes and problems are, for instance, amongst many people defying stay-at-home orders, holding social gatherings, and not staying within 6 feet apart, the problem becomes larger because people are not seeing COVID as a real illness to death case, rather just an excuse to party or as fake news. The second effect it has, well, according to Octave Soren Candle's article in Journal of Media Research on July 2020 stated, fear is a normal response when facing a crisis. And he also stated that corrective information allows the people to understand better the risks associated with a pandemic such as COVID-19 pandemic. But it also may lead to the development of positive emotions and helpful coping strategies. My second point is how COVID spreads, the causes of it. Well, one cause and how COVID spreads is that another underlying issue and probably the main source of infections with COVID is that many people refuse or fail to wear a mask in public. Just by wearing a simple disposable mask can save a life. And it's cool because you can just throw it away and get a new one. So it's even better actually for your health overall. Second cause is that they have this not caring or not taking it serious enough kind of attitude toward this pandemic, toward this disease, toward this virus. While many people take on the approach of I don't give a attitude, it also doesn't help to stop COVID. The Foundation for Economic Education published in CE Think Tank Newswire on June 2020 stated that, strictly speaking, a person's viral load is the number of particles per volume of a person's blood or sputum, and also stated that other things equal the higher a person's viral load, the more likely the person is to become infected with COVID-19, the more likely they will develop a severe case, and the more likely they will infect others. For instance, this is all it takes, guys. By you opening your mouth in public, not wearing a mask, this is what comes out. That's the virus. All those germs, that's what causes people to get sick, because people are not wearing a mask. In other words, by speaking without a mask is the cause for so many COVID cases being spread on a global scale, not just in the USA, but we're talking globally now. Which also, with COVID not having a cure yet and people not practicing safe guidelines to slow the spread, we also have the logical aspect why we must wear masks in social settings. My third point is the solution. It's logical to wear a mask. By just wearing a mask, a disposable or a reusable one, which when you use a reusable one, you have to wash it every time you come back home. It is very pivotal to your health that you do that, because when you've come in contact in the outer world, you don't know if someone is not wearing the mask or you've forgotten, and guess what? Germs are everywhere. The virus could be anywhere. That's how people have come in contact with, by simply not understanding that the virus can be on most objects too. And just wearing a bandana, guys, this will help you. It may seem like it doesn't, but it will help you. I've worn my bandana, I've worn my disposable ones, and I've thrown them away right after I've used them, because I don't want to get sick, and I don't want, what if I'm a carrier? I don't want to get someone else sick either. Let's be responsible, guys. Let's respect each other. The Foundation for Economic also stated that for the economy to improve in the short run, we need practices such as less public transportation, less open face office designs, and wearing masks. And as far as drugs, remdesivir and other promising candidates that will improve our odds of dodging infection or help mitigate the severity of infection. Just doing these simple steps, guys. If you're in social settings like that, that's not being safe. Simply washing your hands, simply wearing a mask, simply covering your mouth when you're sneezing, just disinfecting regularly. Staying at home is also the best option. But when you're touching your face, like this one right here, with perhaps not sanitized hands, you don't know what you touched. When you're touching your face, that can potentially lead you to get the virus, because like I said, it will land when you're speaking. Your saliva, you're spreading through your saliva your germs, your bacteria. You're ultimately speaking the virus, if it makes any sense. I know it's funny, but it's not funny, like that's really how it happens. And the last reasoning is logical. If you wear a mask, follow the guidelines, the quicker we stop the spread of COVID-19. If it works to wear a mask by doctors and scientists who have said it, then we should be able to wear a mask so we can have an honestly, so our economy is running again because of all these new cases coming up day and night. The economy is suffering. There's people that have been laid off. Disney even had to lay off many thousands of people, and they're trying to work on getting more people to work again for them, but it's hard. The economy is suffering. Restaurants are suffering. Half of the malls are closed because how is it going to run if there's no people to go anywhere because of COVID? Daniel Bachman, senior manager of Deloitte Services LP, stated in March 3, 2020, that it takes more than a year for the World Health Organization and the United Nations to develop an accepted global response that prioritizes health measures based on effectiveness and cost to the wider economy. And for this response to be accepted in the major world economies. In conclusion, I want to leave with this. Today we discuss coronavirus, also known as COVID-19, an illness that is spread from contact to contact, whether it's an object that has come in contact with someone just speaking, as we know. The causes, the people that are in denial of this virus, their maybe their denial and ignorance, how people are not wearing a mask and respecting contact with people affects us all. This is my closing thought. I hope that I have shed some light about the dangers of not wearing a mask out in public with you all today, and that you will think more critically about your choice in wearing a mask in this pandemic and respecting COVID rules for our safety, health, and society. Wear a mask, guys, or a bandana. It saves a life.